at the heart of the problem is the fact that we can bring all these in IT, and we can bring all, technically we can bring all these systems together. We can put them all in a data lake. I think the next level of this is, how do we provide a common set of tools or a common set of ways to query the data so that we're all actually looking at the data and talking about the data the same way. So when I say patients with diabetes, it means something to the organization, or patients with CHF, and maybe it's patients with CHF defined by Pop Health, or patients with CHF for the clinical organization, or whatever the case may be. But really, it's really kind of then working with your operational leaders to kind of say, what are the enterprise reports that we need to develop at an enterprise level that can be shared by all the different parts of this business, right? And how do we have a common sort of modality? There's a common way we define how we say length of stay, or as a common way to understand volume, or RVUs, or whatever the case may be that you want to do. You don't want to have every sort of market figuring out that on their own, because the nuances can really kill you, and then you can never really compare things. So I think what IT does is bring the data together, then work with operational leaders sort of to say, how do we best use this data? But then also, how do we provide a common set of tools? Because you can't really kind of rely everything on the enterprise. So everything is going to be, wait in line, someone in IT is going to deliver your report. That never works. So, but I think, you have to sort of, again, then democratize the whole thing. In essence, is have your local folks have some sort of self-service capability. But when there's a good opportunity for a processor improvement, or there's an enterprise report, how do you take that local sort of idea and enterprise it, and say, hey, we want to take that wonderful report, and we see that you've operationalized your ambulatory clinics in primary care, and now you've increased access through some of this data. How do we now give that to the rest of the primary care doctors in the enterprise? And that's really an operational thing, and really understanding how to use the tools, because the data is there. I mean, obviously the data is there. We've been bringing these systems together, and whether you have a common platform or you don't, bringing the data together, creating accessibility, and then creating the standards by which we can actually understand and ask questions of the data in the same way is really an operational piece. And I think that's the piece where, it kind of does stop with IT, but it's in cooperation with our operational folks, our clinical folks, our quality improvement folks, our finance folks, right? Each one has a different view of how to use that data, and a common set of ways by which we can sort of even interact or even talk about the data. So I think that is really the key. And the crux of it is it's not a technical problem. The crux of it is the process problem. It's a culture problem of the way we look at the data and how we use the data. So I think that's really something that, really needs to evolve in an organization. And, I have always seen this in the sort of the microcosm in the old health system. I was with Northwell Health for 10 years, and we grew to be, one of the largest healthcare systems in New York State. We had, micro sort of markets come together, but now I see it across the country at CommonSpirit Health is we do have things that we can all agree upon are we're going to sort of measure the same way, and then we can sort of move forward. Otherwise, it's hard to sort of translate things from place to place.